everyone. I'm Max Rogers. I'm Executive Director with the Neurological Alliance of Ireland, and I'd like to welcome you all to the Mayo launch of our Patients Deserve Better campaign. The Patients Deserve Better campaign is a collaboration between the Neurological Alliance of Ireland and Roche Ireland, and it's seeking a consultant neurologist for 5 regional hospitals throughout Ireland, including Mayo Hospital. What we have at the moment is very much a postcode lottery, where some regional hospitals have outpatient neurology services and others do not. And this is despite a clear recommendation in the 2016 National Model of Care for Neurology Services that Model 3 hospitals like Mayo would have a dedicated outpatient neurology service. You will hear this afternoon how people with neurological conditions throughout Mayo are frequently making long journeys to Galway to see a neurologist when they could be seen more easily and quickly in Mayo Hospital. I'm delighted to welcome our speakers this afternoon. We have Dr. Marwa Elliman and her colleague, Dr. Thomas Monaghan from University College Hospital, Galway. We have Jackie Keogh, who's the Regional Community Worker with MS Ireland in Mayo, Roscommon, and we also have 2 people with lived experience. We have Louise from Ballina, County Mayo, who's a person living with multiple sclerosis, and we have John Costello, also living in Mayo, who's living with Parkinson's disease. Before I hand over to our first speaker, I want to thank the local TDs and councillors who are represented on this meeting today. If anyone has any questions, because this is a webinar, you'll have to use the Q&A. So type any questions or comments into the Q&A at the bottom of your screens, and we'll bring them to the panel. So thank you all for your support. I'm going to hand over now to Dr. Elliman and Dr. Monaghan, who will outline the need for the difference that it would make to have a consultant neurologist in Mayo Hospital.
Okay, thank you. Thank you, Max. So my name is Dr. Alamin and my colleague's name is Dr. Thomas Monaghan. We're both consultants here in University Hospital, Galway. And I guess we're both here because of how important we feel this meeting is. So we both feel very strongly that the people in Mayo do need a local neurology service. At the moment, we serve the people of Mayo. We serve them through outpatient clinics, if they have a chronic condition, or in the acute situation, we serve via giving advice over the phone to our colleagues in Mayo Hospital. When somebody comes into Mayo Hospital with an acute, urgent problem, and then they may be transferred to Galway if the need arises. Very clearly, this is very inadequate for the needs of people in Mayo for several reasons. The most obvious would be that by definition, if you have a neurological problem, you have something that is wrong with your nervous system, which means you might have a problem seeing properly, you might have a problem mobilizing, you might have a problem thinking, your balance might not be good, you might have epilepsy, so suffering from seizures. So this is a very vulnerable population. This is a population that might have disability. So asking them to travel to come here to my clinic at 9 a.m. is definitely not ideal in any shape or form. And secondly, by nature, if you have a problem in your nervous system, it's very difficult to reverse the damage once it's done. So timely access is critical. So we're talking here about a delay because they have to come in here, including in the acute condition when patients are really sick, they have to wait to be transferred. I have to advise over the phone. We here in Galway, who are serving the people of Mayo, we're a Model 4 hospital. We have only 4, in essence, full-time neurologists serving a population of 500,000, which is very little compared to, whether European standards or even Irish standards. We are serving a large cohort of patients with chronic conditions we already have accumulated over the years. UHD, as you probably know, is one of the busiest hospitals in Ireland. We have a massive waiting list. I believe the second longest waiting list in the country because of the above factors. And I asked my colleagues in administration to look at what percentage of our outpatient clinic list is people coming from Mayo to get a rough idea of how much of a difference this would make. And in essence, a quarter. A quarter of the people in our waiting list are from Mayo. And this probably reflects the same when it comes to the acute problems, the patients coming into hospital and so on. It will be the same across the board. So in essence, what's happening at the moment is simply not acceptable. It's really not adequate. It doesn't do the job. And we feel very strongly that the people of Mayo need timely access, need the right person at the right time in the right place. So I do actually believe they do deserve better. So we would advocate for local services in Mayo to serve patients where they are and in a timely, most importantly, manner. That's it. Thank you.
Thank you, Dr. Elliman. And just to recap on what you've said there, that a quarter of the patients coming to Galway are from Mayo. And you believe that people could be seen more easily, more quickly. As you say, you have a very lengthy waiting.
Safely, and more safely, more importantly, in their local hospital. Absolutely.
Exactly. And they could be seen more easily and probably more quickly in Mayo Hospital.
Absolutely, which is so important when you're dealing with something wrong with your nervous system.
Thank
To
you.
be seen more quickly.
And I suppose just to, before we pass on to the next speaker, Dr. Elliman, I suppose just to say that other similarly sized hospitals to Mayo around the country have outpatient neurology services. That this really is a postcode lottery, that Mayo doesn't have that dedicated outpatient neurology service to prevent people, as you say, having to travel from Mayo to Galway.
Yeah. So we have thought about this. Number one, it would be absolutely impossible for the four of us who are looking after, all the inpatients here, the old cohorts. We do a stroke call to provide an outreach service. Okay. But even if we did, that would be still grossly inadequate, because in the end, the numbers are the same, that, you have the same 4 people serving 500,000. And secondly, it does not solve the issue with inpatients. What about if you're just doing a clinic? What about if I get sick acutely and I present to Mayo Hospital? What if I need follow-up the following week as an inpatient? There is still no one to do that. I do not think, like, I worked in England where there was a model similar to that. I worked in a place where the catchment area was 1 million, so double what we have here. We did provide an outreach service. There was 22 of us. Yeah. Okay, so i.e. for 500,000, 11 neurologists, but with 4 neurologists, you will not solve the problem. You simply won't.
So it would completely, as you say, you are agreeing with the need for a dedicated consultant neurology service in Mayo, but it has to be resourced.
Absolutely, it has to be somebody in Mayo serving Mayo rather than somebody visiting to just do a clinic. That's not going to solve the problem realistically. You need somebody who is there.
Thank you. I think you've given that message so clearly from the neurology service in Galway, and we thank you so much for your contribution.
Thank you.
Just as your colleague, Dr. Thomas Monaghan, want to add anything there?
Hi, Max. I don't think that there's really a lot more that I can add really to what Marwa has described. I think we have to understand the notion that, there is, it's all very well to arrive for a half-day clinic once a week or every 2 weeks. But a lot of the difficulties that Mayo University have, and that obviously come to ourselves, are that they do need a local neurologist there. Ideally, I happen to believe that the numbers would justify having 2 consultant neurologists that would be effectively whole-time or close to whole-time at Mayo University Hospital. It is very important that they have links to their other services. But if we compare sort of Sligo University Hospital with 3, Mayo has none. Mayo is a big and very busy hospital. If I look at, the phone calls that I've had today, one of them has been from a GP in Mayo. One of them has been about a young lady who has been waiting the best part of almost 2 months for an admission here. She'll be coming from Mayo this evening. And the third other major issue that has arisen today is an emergency transfer for neurology from Mayo University Hospital that will be arriving later this afternoon. Now, that's perhaps, in fairness, today is maybe an exceptional day, but on any given day, we will expect to have a couple of phone calls from Mayo University Hospital. And I know the TDs will be aware of a hub and spoke model for outreach, but that does not serve the inpatient needs of those patients in Mayo University Hospital. We have massive waiting lists here. I think there's in total between what we call neurophysiology there, the electrical test people have, and the general neurology outpatient waiting list, effectively close to 4,500 people on a waiting list. You know, for something that is reasonably urgent, we try and get people in within a few months. But there are people on that waiting list that easily go back 4.5 years. And that's the situation we're in. It is not going to be solved by one person in Mayo University Hospital, but it will be assisted. And I think, in fairness to the geography of the area, because this isn't just simply about the numbers, it's also about the geography of the area. In terms of the geography of the area, in terms of the demand for services, in terms of a very, very small department, relatively speaking, here in Galway, compared with the other hospitals, I do think there needs to be consideration to 2 consultant neurologists whose absolute major emphasis is in Mayo University Hospital.
Thank you. So I would like to sincerely thank the 2 consultant neurologists from Galway Hospital. You've heard this afternoon how busy they are, how overstretched they are in Galway, but they've given their time this morning, a very busy clinic day, to come on this meeting, on this online meeting, and highlight the critical need for a consultant neurology, dedicated consultant neurologist for Mayo Hospital. They've made the point that 1/4 of the referrals to the neurology service in Galway are coming from Mayo. This is desperately needed. It's available in other hospitals, other similarly sized or even smaller than Mayo Hospital throughout the country. So Dr. Elliman, Dr. Monaghan, thank you so much. We hope you can stay with us for some of the rest of the meeting. Thank you. I want to go now to our next speaker. So I'm going now to Jackie Keogh. She's the community worker with MS Ireland for Mayo Roscommon. So Jackie, if you could give the perspective from service users with MS of having to travel to Galway and not having a dedicated neurology service in Mayo Hospital.
I can indeed. Thanks very much for the opportunity to represent our service users. So in total, I would have over 200 people with MS living in County Mayo on my books. And within that, I have some who experience immense stress when they get their neurology appointment in relation to how are they going to get there, how long is it going to take, how do they plan getting there, and how do they plan that if it's on public transport, they're reliant on the appointment time working alongside bus timetables, who's going to mind their children, how are they going to afford, like I have clients who it's costing €300 from Ballina for a return taxi, wheelchair accessible taxi, and that cost is only going up. If you take the time perspective in relation to people in Belmullet, that's 150 kilometres, that's a 300-kilometre round journey, and that's taken approximately 2.5 hours. If you've no traffic, and those of us who are familiar with Galway know that rarely, if ever, happens. I suppose we'd also have the ongoing impact in relation to their overall health, in relation to that then around fatigue, both after going for the appointment, the stress of trying to plan it. And then I suppose the other piece that consultants both mentioned in relation to those that may present in Castlebar Hospital with a neurological condition where they don't have access to neurology, that delays their treatment. You know, I have clients who have had a delay in their treatment because they're waiting for Castlebar staff to make contact with the neurology department in Galway. And as we've already established, that's a very busy service as well. So, you know, this needs to be timely. It needs to be responding to people's needs appropriately. And it's so needed in relation to day-to-day life for people with MS living in County Mayo.
Thank you, Jackie. And as you say, you're speaking the perspective of people working day to day with people with multiple sclerosis, and that experience is across all neurological conditions.
Absolutely. Yeah.
Epilepsy, migraine, multiple sclerosis, Parkinson's disease, all across the board. That's the experience people are having in Mayo. Thank you so much for that, Jackie. As I say, it's a question of distances, it's a question of cost. There's so many stressors involved for people to make this appointment. And as you say, there's a delay. There can be a delay then because they're going on top of such huge waiting lists in Galway. Thank you. I'm going to move on now to Louise, who's living in Ballina, County Mayo. Louise is living with multiple sclerosis, and she's joined us this afternoon to talk about the lived experience of someone trying to access neurology services in Galway from Mayo.
Hi everyone. Just as Max has said, I'm just outside Ballina. So for me, it's a 220-kilometre round trip, and that's numerous times a year. So that's 4 to 5 hours journey time, depending on traffic. Then you have the parking. Parking in the UHG at the moment is not good. So you're driving around for half an hour, 40 minutes just to find a parking space. Then you have, with me, I have two boys in primary school. So you have to think of childcare before your appointment. You have to think of meal plans, because the last thing you want after a day of traveling is to come home and worry about what's next for dinner. So that you're planning the day before, you're planning a couple of days beforehand for that day and possibly the next day, because fatigue is one of my worst symptoms, and it could affect me for days on end, where just you're not able to do stuff the way you would normally do. You with MS, you also cannot predict how you're going to be each day. So today could be a good day and tomorrow could be the worst. Spasms, fatigue, pain. There's just so much. And it's not just one autoimmune condition I have multiple. And I know from one of my other conditions, which is arthritis, that I do see a rheumatologist who is based in Hamilton, but they have a clinic in Mayo University Hospital, which has been a godsend to me over the last year. It has made a huge change. Castlebar to me is 35 minutes up the road, and it's easy. Parking, maybe 10 minutes of a drive round. Some days you're just lucky you can pull straight into a parking space, other days maybe 10 minutes. And that's a huge change. From a Mayo, from living in Mayo, there's a good enough transport system from Ballina to Castlebar by bus if needs be for people. It's not hours, it's not hours of traveling, it's not more fatigue. So yeah, for me, I think it would be fantastic to see, if not one neurologist, definitely 2 neurologists in Mayo would definitely ease the burden.
Thank you so much, Louise, for that. You've described so much and so clearly there what difference this would make for you and for so many people like you in Mayo that live with neurological conditions. And I think just for the TDs and Senate and councillors on the call, who mightn't be familiar with some of these conditions, these neurological brain conditions, we're not talking about a couple of months of treatment. This is over years. These are lifelong conditions. So people are making these journeys to Galway Hospital over a number of years, maybe a couple of times a year, more frequently when they're diagnosed. There are all sorts of reasons why this is a critically, urgently needed service to have a consultant neurologist in Mayo Hospital.
So if I could just say there, Mags, so I'm attending a clinic in UHG. I also attend a couple of other clinics in Galway as well. But for my treatment, I'm on an infusion, so that's twice a year of a Galway trip to Merlin Park. Fantastic service, but it's hours, and it's for the treatment, that's weeks in planning, because the effects of afterwards you don't know. You wake up and you find out. That's literally the way it is. Muscle weakness, so your legs mightn't work as well today. You could maybe be okay and do everything quite quickly the next day, or I might need my stick. It just depends.
Absolutely. That is as you say, you can never predict how you're going to react. There is so much involved without laying the transport on top of that and the stress of the long journey on top of that. Thank you so much, Louise. And what we're hearing this afternoon is We're not asking for something that's not available for other hospitals. This service is available for hospitals of similar size to Mayo and smaller hospitals around the country. So it really is a postcode lottery that people in Mayo don't have a dedicated neurology service. I'm going to go finally to John. John is a person living with Parkinson's disease in Mayo. And John, if you can just tell us about your experience. Can you hear us okay, Dan? You're just on mute there, folks, if you can unmute. There we are.
Can you hear me now?
You can indeed, John.
No? Yeah. Well, I am a Parkinson's patient myself. I live in a rural part of County Mayo. Really, I'm 3 hours distance to travel by car to the hospital in Galway. The distance is the major issue in my mind, and also North Mayo itself is the size of County Louth, so that gives you an idea of the geographical spread of the county. Patients and their families have stress of trying to get to these appointments. Financial stress, time off work, transfer for patients with Parkinson's themselves who are not financially capable of meeting the cost of it all. When there is a neurological service in the county, it means we have access to specialists, which in turn leads us to little or no information and delayed diagnosis. Roughly, there are 60 to 70 patients in Mayo that have Parkinson's. Another point I feel strongly about is patients are more often than not home alone, that their children have moved away for better job opportunities, so the family support is at a minimum. Also, when you have these services like neurological, other services and support develop naturally. Even when the patient is not well enough to drive, it is a long journey and one needs another person for support due to the stress of driving, and of course, as we heard earlier, for the parking reasons alone. If one has any other medical conditions, then the difficulty is multiplied. Yeah, we in the Mayo Parkinson branch see 60 to 70 Parkinson patients each week, based on our centre here in Castlebar, which I'm a member of. That's about what I have to say about it. I think the distance is the major issue in my mind.
Thank you so much, John. As you say, you're talking about, you just made the point there about a 3-hour journey for yourself, which is just unacceptable to try and travel to the neurology service in Galway. Thank you so much for giving your testimony this afternoon. So just to recap on what we're hearing that 1/4 of people referred to the neurology service in Galway are coming from Mayo. We're hearing that they're making long journeys. They're at a cost to themselves, whether that's paying for, as Jackie pointed out, whether that's paying for a taxi, and the fees are phenomenal for a taxi from Mayo to Galway Hospital. We're also talking about the disruption, the fatigue associated with it. As John has pointed out, you may not have a family member to bring people to these appointments. Public transport links are poor. And what we're really hearing is that for so many reasons, for safety reasons, for a quicker diagnosis, for easier and faster access to care, people throughout Mayo living with neurological conditions urgently need a dedicated consultant neurology service in Mayo Hospital. We're not asking for something that's not available in hospitals of a similar size to Mayo or even smaller hospitals than Mayo around the country. We heard about Sligo Hospital where this service is available, dedicated neurology service. We've had the testimony of neurologists working in Galway Hospital saying that we need this service in Mayo Hospital for the benefit of people with neurological conditions and their families throughout Mayo. I would like to thank all of you for coming and speaking, for all of our speakers this afternoon for coming and speaking today and giving their testimony and giving their expertise. I would like to thank people who have come on the webinar and especially our TDs and counsellors who have given their time this afternoon. Just to say that the Neurological Alliance of Ireland will be physically in Leinster House next week on Wednesday, the 24th of April. We will be highlighting that again. And we hope that Mayo TDs can make that lunchtime meeting on Wednesday, the 24th of April, where we will be bringing Mayo TDs face to face with this issue of the need for a dedicated neurology service for Mayo Hospital. So thank you all. If you haven't already done so, I would urge you to visit our dedicated campaign website, patientsdeservebetter.ie, where you can contact your local TDs and senators and highlight this issue. But I would join with all of our speakers from today, with Dr. Elliman and Dr. Monaghan from University Hospital Galway, from Jackie from MS Ireland, and both Louise and John living with neurological conditions, with multiple sclerosis and with Parkinson's disease. Our campaign will run right up to this year's budget, calling for a dedicated neurology service for Mayo Hospital. Thank you all.